Hi, I'm Dr. Sonia Doherty, ND, and I'm here with my sister, Dr. Krista Doherty, ND, and we're so excited to have our first exceptional ND interview with Dr. Taylor Bean, ND. So,
Hello.
thank you so much for coming on. We're really excited to have you participate in this part of our platform. We really want to focus on naturopathic doctors who are doing exceptional work, with patients or educating patients, educating other naturopathic doctors. And of course, when we were making our list, you came to mind right away.
Mhm.
So
Awesome.
before thank you. Yeah, I mean, before we jumped on, we talked a little bit about, hey, where are we going to focus this? Because I think we all would love to talk to each other all day long, and
hmm
hear
hmm
everything that you've been up to. But you touched on something that I thought was really powerful, and it's this, concept or the importance of accountability. So
hmm
when I say accountability in naturopathic medicine, what does that make you think?
So the accountability to me has been, it's evolved over time. And that evolution of accountability has really come over the past 2 years. And what that really means, because as we've all seen in the media and friends and family, is in order for me to be okay, you have to do something. And the reason that I feel the way I feel is because of you, actually, which really is not the case. How you feel is actually based on the decisions that which you make or do not make. And that's where the accountability comes in, is that we individually need to take accountability for what we do for ourselves or what we do not do for ourselves. So the fact that you are sick, be it whatever that looks like, you're vomiting or diarrhea, or you have a cold, be it's what you did something to yourself. It's not what someone else did. And so trying to reframe this accountability piece, which actually falls into prevention piece, of course, too, but the fact that you're sick or you constantly be getting sick, it's not what other people are doing or not doing around you. It's be it you're deficient in something. You're not taking your vitamin D, your zinc, your selenium, your vitamin A, or you're on multiple medications that are suppressing your immune system, but you don't even know it. But no one's either helped to teach you that, or you haven't looked into the fact that you are maybe suppressing your immune system. So you have to take accountability for those choices and decisions, and be it you have to be on something, but then recognizing the con with taking something. So that, it's really evolved for me. Just, because I'm not about the shame blame game. I never have it. I never will be. And, that kind of narrative that's out there, the shame and blame game, is easy because it takes away your responsibility and accountability for yourself. Because it's really hard in a lot of ways to take accountability either for your actions, your emotions, your choices. It's super easy to punt it and blame somebody else. And that just alleviates the pressure off yourself, because it's like, well, it's because so and so, or it's because of that, or it's just because I'm busy. It's just, so forth. It's raining today and therefore I can't, do XYZ. But really, you can find a reason how you can do something, but that's hard and that's harder. And so as a naturopathic doctor, we're coaches. Doctor as teacher, we're here to teach you. We're your biggest fan, and really helping with language and teaching our patients really to take that accountability. We're with you with 1% of the time. 99% of the time it's on you. We're going to give you those tools, but you have to implement them and take it seriously. If you really want to achieve a certain health and wellness, well, it's not easy. There isn't a pill for a lot of this stuff. And a lot of it's mind over matter. It's mental health too. And I think also in the last 2 years is really, really worsened mental health. And it's been really inappropriate. And so where I then point fingers at people that you created some of this, your language created this. You need to take accountability on how you're talking to your patients as well, because you're creating further harm. Do no harm. So this is, I mean,
Scaring the cow.
it's a cow in the field. I am so sorry about this. So this is, all of these components to me is there's a huge gaping wound in medicine, and so many people are falling through the cracks when they shouldn't be. And we should be doing our job to the extent that why we all got into it. I mean, part of the reason I got into naturopathic medicine is because of the model. the model of the business, the model of I have that patient and that patient stays with me, that continuation of care. I have an hour with you. I decide how long I get to be with you. I do not have to be under the model of 15 minutes or 5 minutes with you, 7 minutes. And the model of only talking about one problem at a time, because it's all connected. The fact that you have a headache versus your, stomach issues. I knew that, but that's part of why the model of conventional medicine was not for me. I know that I'm not going to be able to do my job of what I want to be able to accomplish, which is fixing the person. I'm not going to be able to accomplish that. And having to work 16-hour days, probably going to make a lot of mistakes as a result of that. And that's not okay. And I'm going to have to live with those mistakes as well. And be it you're trained to just know that mistakes happen, it's just not good enough. So I want to have that full control. Basically a control piece really is my patient, you're with me, I know everything about you, and we're going to work together from start to finish. And if you need to see a specialist, then it's appropriate. You need to go see a specialist, or you need a surgery, or you need imaging. Fine. But we have all of it in one place and we know exactly what's going on. And I'm also going to take everything you say seriously as well. And so it's not me to say that that's not happening. It's your body or it's your child, and this is what is happening. So, that was a big part of getting into this. And so, and this just has grown over time, this evolution. Having children is really what, for me, was born, literally, informed consent. And that was the beginning of it. Having a child and realizing my choices, my options, and how I wanted things to be done. I had 2 home births, and my first child was born in Singapore, home birth, which is not really the norm in Singapore, but it's what happened. One obstetrician in Singapore would attend a home birth, and having my son born at home was just this whole, born out of this was my choice, my capability, being informed of, be it home birth, in a pool, the position I want to be in. And it was a beautiful experience. It was nothing like I thought it could, as we all think it can be. So that's where it started. And, obviously we all understand informed consent, but informed consent seems to have a bit of variance to it. I can withhold information, and I've informed you of supposedly the most risk or benefit, but I could withhold information and you wouldn't know it. But this is where I think that is important for you to know and beyond, so you can make a full informed decision. Because the worst thing that could happen to me personally is having someone come in and say to me, "You never told me that. How dare you not have told me this? And I know you knew this." And that is something I want to avoid completely, because I did not do my job to the best of my ability. If someone then goes on and starts reading and says, "But this is so clearly here, and you never shared it," or I didn't share other resources for them to go to learn, so they could be fully informed, because that's what informed consent is. To be fully informed before you make a decision, and all the risks and all the benefits of that decision, whatever it may be. And you will do that if you're for your colonoscopy or, surgery, everything else. There's nothing that should not get that full expectation. Vaccines are no different. So that for me is that informed consent for parents, so they can make a fully informed decision. So that if there is something that, if there's an adverse reaction, be it it's, mild is typical, but moderate, severe, and knowing what that is, and what to look out for, and how we would observe that, and what we would do, to a parent is like, okay, I get it. Okay, so I'm going to move forward of whatever that decision may be. And I have lots of parents that decide to vaccinate. Parents have always decided when they've come in that they're not going to vaccinate. And as a practitioner, our job is not to manipulate our patients into doing something, but providing that unbiased information for them to make the decision for themselves. And so that's another piece to it as well, is that language that which we choose to use, be it for our own benefit, what we think a parent or a patient should do, we can certainly twist our words and manipulate them or convince them to do something otherwise that we think is the best. And be it we do think it's the best, but again, it's their decision, and you need to give them all the information for them to make a true informed decision, without regret or without frustration once after the decision is made of like, well, you didn't, give me everything that I needed. So yeah, so that sort of full circle of accountability, sort of vaccines, and why I got into naturopathic medicine. It's other reasons, but that was a big reason for me to get into it.
I love it, because it's so inspiring to naturopaths to hear the information that you're sharing. And some naturopaths, like, we can't talk about vaccinations in Ontario. We can't give vaccinations, but it doesn't have to be about vaccinations when we have these tough conversations with our patients, right? And I think that you touched on so many important pieces, the clinical pearls that everyone can benefit from, like, brand new NDs and NDs who've been practicing a long time. And we need to listen to our patients, right? We need to lighten the load. I love that term, because we are supposed to be leaders, and our role is to guide our patients and inspire our fellow NDs with that integrity and authenticity. And I think you can't do that unless you're coming from a place of truth and the knowledge that we have. You're right. And I love it. So there was so much in there. I love it. It's incredible to have you share your experience. And you're a really successful naturopath. You're a mom. I know you've got some fun endeavors going on in your new homestead. I don't know what to call it.
Yes. Well, yeah. I mean,
that's incredible too.
Totally. I mean, we're turning into we're newbie farmers, really. But yeah, I mean, that's sort of part of taking the accountability. Not that you need to go out and buy property. No, because you can do that if even in an apartment. You can do things where you grow your own things on the patio, even inside. There's lots of stuff that we can grow. It's just, we happen to purchase a lot of land. So now we're going to use it. We're going to make something of it and grow things. So, but, what people just are not aware about, because who's going to talk about it?
And this, I think, comes to the point of sort of like courage and leadership, and what our role is naturopathic doctors. And I love that you touched on that continuum of care. Like, we should be with our patients for the long term. We should be the place where they can come and ask those hard questions, right? And for those of you who don't vaccinate, I keep thinking of the Lyme world, right? Where patients come and they say, well, I want antibiotics, and you still have to take the emotions out. You have to give them, informed consent and your expertise. Or if I'm working with a child with ADHD and the parents are saying, well, we don't want to give them drugs, but all these things are going on. And you can, well, whether or not you take a medication for ADHD, there's still all these other factors like gut health and production of serotonin and making sure we're managing anxiety and addiction risk. So I love all the points that you've made. And I can't thank you much. I can't thank you enough for your perspective on care, because I just think people could watch this over and over again, no matter what they're doing in their own practice, and, focus on language, focus on being that person for their patient. The constant, one of the constants that maybe very few people might have in their life. And obviously the unbelievable wealth of knowledge. So I'm thinking, we'd love to probably have you on and train some of our docs at some point. Once we get up and running. But is there anything else that you want to share with us that you have on the horizon that we can share with our fellow naturopaths? Because you're doing such an amazing job.
Oh, amazing.
With helping our community.
Yeah, well, we are in January. In March, I will be at MAPS, the Medical Academy Pediatric Special Needs. For those that don't know, or that is a big conference that's held in the United States twice a year. And in March we're in North Carolina, not Florida, this year. So I'll be talking about infant immunity and vaccine optimization there. I do have webinars that I do. Interestingly enough, I got a lot of people from Ontario that seem to that do purchase them, which is great. But I think, and that's going to oh yes.
That's awesome.
That's it. It's 8 parts. I've done them a few times. It was just too much. And I would do a 3-part series, a 4-part series. I made it 8 parts because it's just slice and dice it a little bit more in terms of what I'm offering and the information, because it's a lot of information. It depends also what maybe you want to know. So the first one is about infant immunity. And I think that that's really important because that's where a bulk of vaccines occur. So I think it's important to understand a bit more about infant immunity and how it develops, because it does develop. You're not just born right out of the gate exactly, an infant versus a 2-year-old is totally different. So what does that mean and why? And does that change in terms of when you vaccinate or how many and so forth? Particularly if those that have come back and haven't vaccinated, what does that look like depending on their age? The second one is about pregnancy and breastfeeding, passive immunity, and if you get a vaccine during a 3rd trimester, your boostrix, what does that mean for your kiddo? 3rd and 4th around the bacteria that we vaccinate, and then viruses that we vaccinate, and also educating what a bacteria is versus a virus, because they're two totally different things. Because then you get to know the infections in those. COVID is not on there because this is pre-COVID, but to get to know what the difference of, and also how potentially we would treat or support a body towards each of those two. And then I get into aluminum, because that's a big component. I think a lot of people don't understand the difference between aluminum in a vaccine and aluminum in food, because that's apples and oranges, although they are compared exactly the same. When people do that, it's very clear they have no idea what they're talking about. Sometimes I have the energy to help them understand. A lot of times I don't, because it's like, whatever. You're going to post this meme that, food has more aluminum than vaccines, but you don't know the difference between adjuvant and water soluble aluminum. Clearly that's clear, very clear here. So I go down that full talking about aluminum because I think it's important to understand, and SNPs. So I talk about a little bit on the genetic side, because people say, well, if I have M2HFR, I can't get vaccinated. And so blank statement. And there's a lot that's missing in understanding genetics, that if you're going to focus on MTHFR, you're actually missing a lot on other SNPs when it comes to vaccines in terms of efficacy, if you're primed to be really inflamed and so forth. So we get into that. Then I get into efficacy, safety, and what research means all in one in terms of vaccines. And then I also talk about placebos and what placebos are used within vaccine research too, and why certain placebos are used. And then the 7th one is actually just about how to optimize our kiddos' health overall. It's nothing to do with vaccines. But what are you going to do for gut health and sleep and so forth? And that's sort of a fun one. That one's light. That one's good. And then the last one is how I optimize vaccines. What does that mean as a naturopathic doctor, and what does that look like? And so typically the 8th one is really what I'm doing with patients in the office. But a lot of takeaways. So, I mean, I've had colleagues listen to it. There is a lot of information. Some people it's too much, but when we're talking about a subject matter as this, we're not going to go easy on just, generalization or fuddy-duddy information. It's going to be, look, here's research paper. And so, because everyone says, show me the science. So, okay, that comes with the tagline of when you're talking about vaccines, show me the science. Okay, sounds good. I'll show you what there is, and there's a lot of there isn't. So it's just not out there to share. So anyways, the 8, you can pick and choose which one, but that has been for me a really good resource for patients, because I can only talk about, I don't know what you don't know, and there's only so much I can talk about in an hour. And usually after talking, people are like, well, I'm a little bit more confused than when I started, because there's so much I didn't realize. I'm like, well, I'm asking your questions, which kind of takes us over here and it takes us over here. And, I don't know what you know, but, I'm answering your question, which just brings up more questions. So as one does, because you have a right to understand, you have a right to that information. You're free of information. So what is it you want to know? And I should be able to answer it. If I can't answer it, then I will say to you that I don't know, or there isn't that information to provide. And any practitioner that you work with, regardless of medical doctor, nurse practitioner, nurse, naturopathic doctor, nutritionist, chiropractor, I mean, we should be able to say to you, either we know this and here's the information, or we don't. There's really just put the ego aside, because there's no ego in medicine. I don't know where that comes from. I am not better than you. And it's my job is to fix you. And if I can't fix you, then, be it someone else knows a bit more than me, and I will share that you with someone else, and they have the tools that I don't have. And so I don't know where this hierarchy of I am the, person, and I, be able to support you and listen to me, and it's only me that can help you. No, I mean, really, it's a collective. The person in the middle, we all should be circling, be like, oh, how can I help? And what are my thoughts? And how, and so whoever fixes the person, great. It's not, we're not in competition. So, anyways, that's what the webinars are there for, as a resource. They're not going to tell you what to do. That's a big point of this. Is, as someone that supports some of the vaccinations, I never tell people, well, what to do. I mean, there's a recommended vaccine schedule. A lot of people say, well, what should I do? Well, which one should I do? And what do you think? And what would you do? It's like, this is your decision. I am here to help you make that decision. What is it that you want to know to help you make that decision? I don't. And that sometimes frustrates people because they want me to tell them what to do and hold their hand, and fair enough. But there is a recommended vaccine schedule. You're the one that's making the decision. And if someone says, oh, why did you do what you do? You're not going to say, well, because Dr. Bean said. It's more of, well, I made the decision because when I looked into this and I understand this, that's why I made the decision for me. Because everyone's scenario, lifestyle, relationship with infections are different. And so this is where we have people that just scales of comfort level with infections, where someone's like, I don't care that my kid licked the wall, where another person is like, oh my goodness, I'm freaking out. They need it to be on antibiotics. Like, there is a spectrum here. So where are you within that spectrum to help you make the decision? And that helps to be like, okay, fair enough. All right. And so people know that when they get into having a consult, I'm like, I do not have an alternative schedule. I don't even know what that looks like. I've never had one, never made one. It's you and me, and that's it. And we make a decision what's best for you. And then we go from there. And so no two people are going to be the exact same, because they're not. And so for some people that works, a lot of people that works, some people not so much, because they want to be told what to do. So I'm like, no, this is on you. You'll take accountability of your decision, and we go from there. It's not on me to take that accountability. There's a recommendation. So it's sort of altering that way of thinking too for some people of there isn't just a one all be all. It can be unique to you, and you're coming to me and your child is 5. So, now what should we do? You tell me what you want to do, because there is a recommendation and you're not wanting to do it. So, I think that
that's awesome.
You get into this profession to help people. You have a voice, use it. You can, yes, we have where things we need to be, aware of what we're saying and how we're saying it. But patients want a leader. Your patients want a leader. They want you to take care of them. So do that. And you have a duty to do that. You don't need to, stand on a podium and start talking about things. No, but you do that in your office. You advocate for them. Okay, I'm going to call this person, or you're right. Let's look into this for you. You're right. Let's do some research for you. I found this for you. I'm hearing you. That is, that obviously is awful. Patients, I can't say I've ever had a person come in and fake or malingering of what's actually going on with them. They're not going to pay premium dollars to come in and tell me something that's actually not true. And so I know that. And that's why people then will turn to an ND, because like, well, let's go private. Clearly, no one's listening to me. They think I'm making it up, and this is super fun to be here right now. And the ER or in a doctor's office, although it's not, I'm sure people could do something better with their time than be faking how they're feeling. To the extent that which we see. So, I think, as new grads, old grads, wherever you're at in your career, you have a duty to take care of your patients and stand up for them. I don't care if I disagree, if someone's like, oh, Dr. Bean, like she's still, I don't care, I really don't. And maybe that takes a bit of your own journey to get to that point of your own maturity level. because I know what's right and I know what's happening in front of me, and I will stand up for that. And that is just how it will be. That's because I can't stand bullies at all. And I'm very competitive. So put those two together.
Why are you pointing at me, Krista?
I don't know. I don't know. Have you met my sister?
I'm competitive.
That's a good combo. It's a really good combo, for sure. Because I won't stand for the bullying at all. And the competitive piece is like, well, I'm going to go up against this bully. No problem. Because we're going to, to me, winning means I've been able to show that bully the accountability component. That's on you, actually. And when I talk about like on stage or in a write-up about language, I haven't had one person disagree with me when I say, if you're going to shame and you're going to gaslight, you are going to create hesitancy, or you are going to make a difference in that person's brain that you did not intend. And so you've got to take accountability for that. And so you are changing the landscape. If you want a person to vaccinate, you don't tell them that if they don't vaccinate, their child will die. That's not how you talk to somebody, but that's the language that people use. And so the parent is just like, what are you talking about? Holy Toledo. And so this a mountain of emotions that this person now needs to deal with and get through. And to the point where, like, I guess, okay, we're going to, and to them, they're not making a decision out of, yes, necessity. It's just sort of blindly going and doing it because I have no idea. I totally have to do this, I guess. Or they halt, like, why are you talking to me like that? This is way off of how you're speaking. You wouldn't say this about anything else. So it's created a real interesting time in terms of how, and be it, I've seen some alterations in language and for medical doctors and public health and nurses. I've seen a little bit of the change in terms of navigating language, but it's not changing really. But they're trying to educate, and be it they're realizing what's happening, and that method is not working anymore. Never was. It never will. And so patients deserve better. We are supposed to be unbiased and provide information, and that is our job. That's it. And then our patients decide, and they consent to whatever it is that we've suggested, and that's it. And we've done our due diligence, and that's it. And how you support your patients. So yeah.
I love it. I'm so thrilled that we got to chat. I
Me
feel like with
too.
NDs we could spend so much time. So one of the most exciting parts about Exceptional ND for me is I get to connect with NDs like you who are doing such phenomenal work, and then share that with our colleagues. And I keep saying this, but the world needs naturopaths more than they ever have. And so thank you
my
so
pleasure.
much. And people can find you at www.drtaylorbean.com.
Yes. So that's my website there. Yep.
Awesome. And your webinar series is up there, and some great blogs. And Dr. Bean's an international speaker, and I loved what you had to say today. So thank you.
Awesome.
Thank you so much.
Well, thank you guys for having me. Yeah.
Which is so cool. It's amazing.
It's really
I know.
Cool. Really
and
cool.
It couldn't have been better. So
awesome. Very honored to talk to you too. And hopefully we cross paths, now that we can be in person at conferences, and I love conferences. So
we'll make that happen. That's fun.
Yes,
yeah,
absolutely. But yeah, thank you both for having me. This is great.
Amazing. Okay, well, I'm gonna stop the recording here, and we'll look forward to meeting more exceptional NDs as the year goes on.
Yeah.
Perfect.
And we'll touch base because meeting will be fun. That would be a good time.
It would be a good time.
Yeah, we need to connect.